Good afternoon. My name is Steve Breslin. I'm an architect here at NIH. But my comments are really addressed to the non-architects in the room. And looking at the attendee list, I think a lot of you are not architects. I want to talk about the design process and how it relates to healthy buildings and why our buildings aren't as healthy as they could be. Some of the earlier presentations, we saw some very nice pictures of some pretty wonderful buildings, but I think they're really the exceptions when you look at some of the buildings that come out of our institutional design process. So I want to talk about what the process currently is, why it drives the buildings that we have, and maybe what we can do to change that a little bit. So right now, if you're doing any kind of institutional work, and this is state, this is federal, this is university work, an architect is contractually obliged and legally obliged to follow certain requirements and standards. The first one is project parameters. In some cases, that's really called a program of requirements. And what that does, that talks about the specific functions of a building. It talks about the minimum sizes of spaces, the numbers of spaces, and usually the maximum first cost of the building. Well, when you take the maximum first cost of the building and the minimum sizes and numbers of rooms, you end up with the building efficiency. And generally speaking, the project parameters dictate a very, very high building efficiency. And the people who are setting this, who are usually upper management and accountants, they're always striving for the most efficient buildings possible because they want the most building for the money. And that just makes sense in a high, in a high cost environment and low budget environment, where we've been for a long time. So you've got to abide by the project parameters. You have to abide by the institutional design requirements. Now, most institutions, whether it's the federal government, universities, almost any large entity, has institutional design requirements that you have to follow. They set minimum requirements and uniform standards, and usually that is an illustration of what's worked for them in the past. There are certain products they like, certain systems they like. It's worked for them in the past. It's efficient. It's standard. So you have to abide by that. Now, neither project parameters or the institutional design requirements say anything at all about health or healthy buildings. It's minimum sizes, it's maximum first cost, and it's almost lowest common denominator requirements. You don't get into health until you get into building codes. Building codes is everything from the International Building Code, the various mechanical codes, electrical codes, fire codes, state and local codes. Now, they address health, but they address health kind of tangentially. They talk about, they protect occupants from unsafe and unhealthy conditions. So the building is healthy in that you're not going to die in a fire, and you have proper air circulation and such things. But it doesn't address the health of the building per se, as we've been talking about it. Green building rating systems. Often a building is required to attain a certain green building rating, LEED Gold or whatever it happens to be. They address health, but they also address health kind of tangentially through protecting the environment and promoting stewardship of resources. But as far as some of the things we've seen about the stairs and the atriums and the public features and the social spaces, they're really not dictated. So when you look at these requirements that an architect is obliged to design to, really, health really isn't in there very much, except for very tangentially. But that's okay, because architects know all about this. Architects through education and just through, they wouldn't be architects if they didn't care about healthy buildings. And this is from AIA Public Policy. It talks about beautiful and healthy places. Throughout the AIA, what it does, its mission statements, its past history, the health of buildings is very important. It's taken very seriously. And architects, I think, get it. When you talk about things like healthy buildings, I think architects will nod in their heads. And they tend to bring healthy features to a building. And it's not surprising that when you get your first designs from an architect early on in the design process, they incorporate a lot of these things we're talking about. Atriums and communicating stairs and outdoor features, accessible roofs and balconies, all the social spaces, the things that make a healthy building healthy, very, very often are in the design, at least initially. But what happens then? Value engineering. I don't know if you're familiar with the term, but it kind of scares people away. And it should. Value engineering, almost every institutional project, state, local, federal, university, has to go through value engineering. Now, what it should be an approach that seeks out optimum value for both first cost and long-term investment. Now, if an institution looks at its optimal long-term investment, it's going to look at things like life cycle cost versus first cost. It's going to look at increased productivity, morale, retention. I think we've all seen information that the largest cost to any institution is the people, and a small increase in productivity way offsets a more expensive building. But that's long-term cost, and which value engineering should address. But value engineering often is a process for just reducing first cost to meet a predetermined budget. So the targets tend to be things like natural materials, communicating stairs, terraces, balconies, accessible roofs, public and social spaces, and all the things you're looking for in a building. They're absolute targets if you're only looking at first cost. And that's what value engineering tends to be, as a fact. So what can you do about it? What we would propose, what we work toward, is an improved building design process. And what we have to do is, project parameters should include spaces and budgets for healthy components. If it's not written there that the building, the cost and the budget for these healthy amenities have to be in the project parameters from the beginning. It has to be integral with the building. If it's not integral from the building, it will be value engineered out. If it is integral with the building, it'll survive. So early on in the process, when the budget people are putting together a budget for the building and the planning people are putting together square footage for the building, they have to include these things. It's not number of offices, it's not number of laboratories or classrooms or whatever the programmatic requirements of the building are. It's also some of these kind of softer, healthy features, which in some ways, as we're hearing, are just as important. The institutional design requirements have to develop institution-wide goals and approaches toward healthy buildings. And again, if it's the requirement of the institution, it's written down in the design requirements, it'll probably survive value engineering. It'll be included in the building. So it can't be a nicety. It has to be a requirement. And lastly, value engineering. Value engineering has to be true value engineering that looks at long-term value, including the value of happy employees, healthy employees, low health care costs, retention, recruitment, and all the soft things which are harder to put a figure on. But an institution looking toward the future, should recognize, and hopefully will recognize, adding value, adding value for their future. That's it. Thank you.